I'd like to invite Suzanne Audrey up to the front, and she's come to talk to us about the Supporting Healthy Inclusive Neighbourhood Environment.
So our HIT is different to all the rest, and I think was partly funded for that reason, because we're aiming to investigate the links between neighbourhoods and health, and in doing that to develop and evaluate interventions and translate those findings into evidence and encourage and support that in Bristol and hopefully beyond. And if you look at the picture there that represents Bristol Health Partners, and then you look at the picture that we've chosen, you can see that we're slightly out on a limb really with the rest of the HITs. Bristol City Council have done masses of work in this sort of area. They have a healthy urban team, and Steve Hewitt is here, who's a member of the healthy urban team. They have transport policies. They are forward-looking in trying to incorporate health into planning policy, and you have this leaflet in your packs that relates to that. You'll know they're very supportive of active travel. They've got a healthy city group. And there is community involvement already in health audit walks around the city. There are lots of other strengths in Bristol. The City Council's got its own in-house city design group, but then we also have a food policy council. We have Sustrans, the architecture centre, are interested in good development. So there's lots of stuff happening in Bristol. At UE, the co-lead with myself is Marcus Grant, who's the Deputy Director of the World Health Organization Collaborating Centre for Healthy Urban Environments. And that gives him links then with these different centres that all relate to the kind of work that we want to do. And then in Bristol, I'm a research fellow with Decipher. So my main role is to help to develop and evaluate interventions to improve public health. We also have links with the NIHR School for Public Health. We've got links with the Randomised Trials Collaboration, and I'm a member of the Conduct Hub as well, giving advice on research methodology. And we've also got links with Ashley Cooper over in the Centre for Exercise, Nutrition and Health, and his new biomedical research unit. And he has a particular interest in sort of physical activity, active travel around the city, and how that might impact on health outcomes. So we've got a kind of ambitious aims, really, but starting off looking at the evidence base that we already have, because I think someone's already mentioned that evidence can be quite weak, and it can be quite weak in this area. We also want to look at what the key local health issues are that we might be able to say are definitely linked to neighbourhood environments, and then obviously submit research bids. We'd like to do some piloting of interventions and of data collection methods. What's the best kind of data to collect so that we can show not just associations but maybe causal links. And we thought that PhD studentships would be really helpful with this, so we've been talking with people like Arab to see whether we have some kind of link between health and planning or architecture. And then in the medium term, the idea is to actually implement some interventions and evaluate changes to professional practice. But I think, as I say, some of this is already being done really in the City Council, and then to influence policies and strategies around our city and hopefully beyond again. So that by the time we, in 10 years' time, we've got a rigorous evidence base and models of good practice, and that we've normalised this kind of working. When I go to transport conferences, I find that I try to talk about health and it takes a bit of a backseat. I have to keep bobbing up and down, make myself known. So we'd like to normalise that. And we'd like to see some real changes to our environment in the city, and be able to link those to physical and mental health and well-being. And hopefully have a cohort of researchers with expertise in these areas. So as I say, there are lots of opportunities in Bristol. My particular interest is in walking. I think if people can walk around the city, then it probably is a healthy city. And in measuring, trying to measure the relationship between that and moderate, vigorous physical activity that we want people to take. But as you can see, there are lots of things happening around the city about good food. The issue is how we evaluate these things. We've got the local enterprise zone. I expect a lot of you are familiar with this ugly building that's been standing there for ages. Millions of pounds are going to be spent in this area, and it would be really nice on the local enterprise partnership to have somebody that was continually talking about health. And then there are local neighbourhood planning areas now where local people have got a real say over what goes on, what gets built in their area. So we've got Lockleys, Redcliffe Way, we've got the Old Market Quarter, Lawrence Weston, Knowle West. A lot of you will know that Bristol's a very divided city in some ways. It's a lovely city, but there are huge health inequalities. So it would be nice to think some real work could be done in improving the health and the environments of these areas, working with local people. We've also got this great opportunity with the Green Capital. And as you can see, the city has committed a lot of money to look at transport and energy efficiency, and it would be good to see if we can inject the health agenda very firmly into that too. And then there is, of course, the joint health and wellbeing strategy, which clearly states that the urban environment can impact positively and negatively on people's health and wellbeing, and that we need to ensure that Bristol remains a healthy, health-enabling and sustainable city. And as you can see, the principles behind that strategy are about having joined-up thinking, being cost-effective, empowering people, and having timely intervention, reducing unnecessary demand on the services, some of the services that you're describing, and commissioning services that are innovative and sustainable. So we want to strengthen this evidence base, but it's a real challenge because what counts as evidence is quite different when I'm used to working now out randomised controlled trials. That can be really, really difficult. I go to conferences now where people present other evidence and then we wonder, is that really strong enough to influence policy and attract funds? And is it joined up? I submitted an article about young drivers to a health journal and they said, we're not really interested in that. Could you put that into a transport journal? So it can be a little bit frustrating, these divisions. It got published in the Transport Journal. We've got a mayor that's on our side. He wants a greener city that promotes and improves health and well-being. And it might have been interesting if we could have told him maybe some of the health benefits of residence parking zones. I know that's a really controversial issue, but we might have people demanding them rather than speaking up against them. Do we know if community allotments help to improve people's diet? Are they a good thing? They look great, don't they? Look like people are having fun. Do we need more benches so that the elderly can get out in the community? Does it actually improve their health? Should we ban takeaways near schools? Have we got really good evidence about this? Can we evaluate whether 20-mile-an-hour speed zones are actually good for people's health? Or closing the streets? It looks great, it's lovely, children's play, and we wouldn't want to stop that at all, but it would be lovely to be able to evaluate this and show some real benefits, and if there are, to really speak up for these policies. So, I just wanted to say, is this relevant to you, really? Because we feel slightly out on a limb and we're progressing our work as best that we can, but it's more difficult to get clinicians, involved in this kind of thing. So can we link with primary care? Can we show clinical outcomes? I'm leaving those really as questions. We think that we would be able to keep people out of hospital and out of care homes if we had better supportive environments. Maybe reduce, GP visits or A&E visits. And that's it. I'll stop there. Thank you.